part of the paramedic program at Cameron College in second year.
Today we're going to talk about nitroglycerin, from bottle to metabolism to excretion.
We're going to go over why we use it and how it works with patients. Nitroglycerin is a nitrate. It causes vasodilation within blood vessels. It is often used to treat cardiac ischemia, chest pain, and angina. Paramedics will often use this drug. To use this drug, they will need to fall under a directive, which is in the ALS 4.4, which stands for Advanced Life Support Directive. We're going to go over that specific directive of what paramedics need to know.
So first, what we look for is indications. So indication for this directive would be suspected cardiac ischemia. So now after that is contraindications. So the first one is allergy or sensitivities to nitrates.
Another contraindications to use this drug is phosphodiesterase inhibitor use within the previous 48 hours.
Systolic blood pressure drop by 1/3 or more of its initial value after nitroglycerin is administered.
A 12-lead ECG compatible with right ventricular myocardial infarction.
So after these indications are met and no contraindications are present in the patient, we look at conditions. So the first is age. The patient has to be over 18 years of age, and the level of awareness is unaltered.
Another condition that is needed to use this drug is the heart rate. It has to be between 60 and 159 beats per minute. And the respiration rate doesn't really matter in this certain directive, so the patient could be breathing at any rate.
The systolic pressure or blood pressure has to be normal tensive, and other considerations as well is the prior history of nitroglycerin use or IV access obtained. So we're going to go over the metabolism for nitroglycerin. So it goes through a first pass effect, the hepatic cytochrome P450 enzyme. So this is a key enzyme. It goes through an organic nitrate biotransformation. And nitroglycerin is also a very lipid-soluble medication.
Now, talking about the excretion of nitroglycerin, its metabolites are excreted through the kidneys, so the patient will urinate them out. And then moving on to the bioavailability of the drug. When giving sublingually, the bioavailability of it is 38%. Just to remind you, the dose for paramedics is from 0.3 milligram to 0.4 milligrams in a little spray bottle, sprayed under the tongue. So I have a patient here who's complaining of chest pain and angina. Could you describe that pain for me?
It's very crushing sensation, a little sharp, and I'm having some trouble breathing.
So now my patient would fall under the cardiac ischemia directives. Now I'd look at my patient, see if he looks like he fits the indications, contraindications, and indications. Patient seems to fit that profile. I could now do an ECG or an electrocardiogram with 12 leads to see what's really going on with his heart. Then proceed to the 15 lead and see if there's any signs of a right ventricular myocardial infarction, and move on with the administration of my drug. So with all these indications, contraindications, and conditions cleared, I can move on and proceed with the drug. I can choose to administer 0.3 milligrams or 0.4 milligrams of the drug sublingually to my patient. Now moving on with the procedure, removing the cap from the nitroglycerin bottle, telling my patient to open his mouth and lift his tongue, and one spray under the tongue should do the trick. And not forgetting that bioavailability, that should relieve my patient of some of that chest pain, that shortness of breath. And yeah.
So I'm Steven.
And I'm Leo.
And thanks for joining us through our nitroglycerin from bottle to metabolism to excretion.